prostate cancer affects around 2,500 Kiwi men each year. And now a visiting US doctor is trying to make New Zealand blokes aware of all of the treatment options available to them. Dr. Mark Scholz has written a book called Invasion of the Prostate Snatchers, and he joins us now. Great book title.
Thank you for having me.
We'll talk a little bit about the book later on. Let's just talk about how well we're doing here in terms, I guess, of awareness of prostate cancer.
Well, there's always room for improvement. The men don't want to talk about this. Men don't want to go to doctors. And when you find prostate cancer early, you have so many more options. It's so much easier to treat. And it's a simple blood test, a PSA blood test once a year, starting at age 40. And men then have options to work with other than having something sneak up on them and hurt them down the line.
Blood test doesn't sound too bad at all. How are Kiwi men, because we often talk about this when we talk about health issues in New Zealand men, the idea that they really don't want to talk to their doctors. How do they compare to the American men?
I think it's a universal male attitude is that we feel invincible with our testosterone, and we don't want to admit that we might need to see a doctor. And so we're trying to overcome that. We have a program we're starting in California called Blue September, which originated here in New Zealand a couple years ago. It's been so successful now, we're going to be incorporating it over in the United States.
Well, that's very good to hear. Awareness is one thing. I guess in the other side of things is once someone has been diagnosed, how our treatment is. And how is our treatment here?
Well, the thing that I contend in my book is that surgery, which has always been the standard treatment, in many ways is more toxic and slightly less effective than some of the other options that men have. Some forms of early-stage prostate cancer can simply be monitored without treatment. Others can be treated with radioactive seed implants, hormone treatments, different forms of radiation.
Are these quite new? I mean, is that why surgery is still, I guess, so popular? In the States, it's still incredibly popular, isn't it?
These other options are newer, it's true, but it's unique to prostate cancer that surgeons pretty much run the show. And when people have been so heavily trained in one way of doing things, it takes a while to change.
50,000 surgeries, I think I read in my notes, for prostate cancer sufferers in the United States.
Right.
40,000 of them, you think, were probably unnecessary.
Yes, many of these men could have simply been monitored without treatment. They're finding prostate cancer with PSA testing at such an early stage now. And then many of them could use a one-day outpatient seed implant that is curing men just as well as the surgery is.
Is there something about cancer that people want to just be the harshest treatment possible? Get in there, cut it out, sort it out, and I can walk away and not worry about it.
And that attitude is usually right for most cancers, but prostate cancer is different. And this is one thing I emphasize in my book, is that there are low, intermediate, and high-risk types, 3 different types. And to use a one-size-fits-all approach really is a disservice to men. They get over-frightened. The low-risk type of prostate cancer has practically no mortality rate at all.
Well, tell me about the risks of surgery, because obviously they exist, because you are saying these other options would be well worth looking at.
Happy to talk about that, because the risks for us, to us guys, are really daunting. About half the men, if you go to the finest surgeons, about half the men lose their ability to function sexually. And about 10 to 15% lose control of their urine. So the surgery for the prostate is unbelievably difficult. It's a very, very difficult surgery.
It's certainly something you want to avoid. There will be situations when it is unavoidable.
Yes, there are certain circumstances where men have naturally very large prostates, and the other options I mentioned, like radiation, don't work as well.
Now, I know this is mainly American, we're talking about, American circumstances. Do you get the feeling that here we are too heavily biased towards surgery?
Well, I've queried some of the people here, and it sounds like your primary care physicians are a little more engaged in the dialogue, which there's so much education necessary because of all these different options. So I haven't tested it out personally, but it sounds more hopeful. We're trying to educate the primary care physicians in the United States to get more engaged.
Look, Mark, thanks very much for joining us. The book you've written is called Invasion of the Prostate Snatchers, and tonight you're giving a free seminar, Sky City, Auckland Convention Centre, from 5:30.
Thank you so much.
Brilliant.
Yeah.
Thanks for being with us this morning.
Is that sort of title going to get it onto the bestseller list, I'm wondering?
I think could well do. I think it's a great title.
It shows a level of a sense of humour as well, and I think we can never lose our sense of humour. We may be losing everything else, but we don't want to lose a sense of humour.